comes with expectations. And one such expectation is having kids. But before kids, there is pregnancy and delivery. And this is an area that we want to explore today. So stay tuned. Okay. So today we are talking about pregnancy and delivery. It is an area that is rarely talked about, or if it's talked about, there are things that are kept secret. I think so. There are things that are not talked about or they're not put in the open, but you just get to experience them. But the objective of this video today is really to sensitize my sisters out there. Sisters, if you are planning to get pregnant, or if you are pregnant, remember, forewarned is forearmed. And a disclaimer, I'm not a midwife, I'm just sharing my opinion. Yeah, please remember to subscribe. So number one, what you need, if you're pregnant or you intend to have a support system, it is very, very critical. When they say that pregnancy is a matter of life and death, it is. It is. We have known of people that unfortunately passed away because of complications due to pregnancy and or during delivery. So create a support system. It can be your relatives or friends, but just have a support system. Yeah. Again, what do you need to know? This is critical. This one is top thing. You know, when you are expecting, what you expect is to deliver naturally. Yeah, but there are conditions that can result in you giving birth via C-section. And sometimes you're fortunate if you know that you're going to give birth via C-section from the word go. But there are instances where that decision is made there and you are in the hospital. So it's a matter of life and death. So that can affect you psychologically because you are going to the hospital, but you are not expecting to be cut. So if you're expecting, ready your mind for that. Ready your mind for that. Anything is possible. Anything is possible. And the unfortunate thing is sometimes, so depending on where you're giving birth, sometimes from when you're wheeled from the delivery room and they bring this little baby, you are expected to take care of that little thing. Remember, you're still reeling from the pain or from the maze of the many medicine they put for the procedure to go on. So you are expected to take care of that little one. So sister, anything is possible. So once again, forewarned is forearmed. Ready yourself for this because we are trying to reach out to the sisters to avoid postpartum stress. When you are about to give birth, your dilation, cervical dilation, I believe it is, yeah, it has to be at 10 centimeters for you to be willed to go deliver. The way they measure that is procedural, but it is shocking. Especially if you are conservative and you have not been warned about that procedure, that can feel like an invasion in your privacy, like literally. So I will not speak much in detail about the procedure because I need to be sensitive. But if we're expecting such about that so that you can be sensitized, remember, forewarned is forearmed. So do your due diligence. Search cervical dilation, yeah. Search about that so that you can at least expect it. Yeah. Once again, remember to subscribe to help a sister. And again, what do you need to know? You need to expect calls. Especially if it's you are in your last trimester. Expect calls from well-meaning relatives and friends asking you whether you have delivered. And that can create anxiety, especially if you have passed your estimated date of delivery. So, forewarned is forearmed. Expect that so that you ready your mind for that. Hey, remember to subscribe. So what else do you need to know? This is depending on where you give birth, whether private hospital or government hospital. Because in some instances, if you are giving birth, you're not the only one in the room. You have several women there with you. So the reactions during labor pains may shock you. Once again, be sensitized. You can have those that are screaming, you can have those that are shaking the bed, you can have those that are sitting on the floor, you can have those that are making their bed. So sister, be prepared for such reactions. It shouldn't, okay, sometimes it comes as a shock, but be prepared. Remember, we don't want anyone to go through postpartum stress. So what else do you need to know? There are those that are fortunate enough that as soon as the baby starts sucking, the milk comes out. But there are instances where milk delays coming. So don't feel bad. It happens. Remember, forewarned is forearmed.